So I started the live stream. The recordings are back up. So if you want to start with the introductions again.
Thank you again, everyone, for being here tonight. This is the Diversity, Equity, Inclusion Committee meeting. It's today. Today is Tuesday, February 20th, 2024. The time now is, I see 7:07. My name is Christine Culpepper, and I am the chair.
Cynthia Rodriguez, co-chair.
And online, we have a few members. You guys want to introduce yourselves?
Hi, I'm Wendy Hewlett-Batts, member.
Okay, we have one member online. We have a couple of community members here. We have somebody in person with us today, and I think this is the first time we're meeting her. But let's go to some of our community members online first. Diana. Hello, Diana.
Hi, I'm Diana Finch, Bronx Park East Community Association. And for your guest, we will be posting the video of this meeting in our Facebook group. So I'm sure a lot of people will end up seeing it. Thanks.
Thank you so much, Diana. Appreciate all the help, support. Miguel is on tonight. Hi, Miguel.
Miguel Dyer, former committee member.
And you want to introduce yourself?
Janka Savorovic, Miss Janka's tutoring local member.
Okay, thank you all for being here tonight. Before we begin, we're going to read our conduct statement. Some of you might know where to find it online. For those of you who don't, just quickly, let's go through it. It says, Community Board 11 meetings must be held in a professional, hostile-free environment. The following rules of conduct are applicable to members of the Public Community Board 11 and Community Board 11 staff. Any action or behavior that disrupts or interferes with Community Board 11 business will not be tolerated during any Community Board 11 meeting and may result in the individuals, I'm trying to go through it quick, being asked to leave. If the action or behavior continues, this may be considered disturbing the peace and the appropriate authorities may be summoned. If the meeting is held remotely, the person may be muted or expelled for the remainder. Repeated violations by the same person or group of people may result in further action by the community board. All public speakers must address the full board or the committee with their concerns. Electioneering for a position other than an office of Community Board 11 is prohibited. Engaging in acts of violence are grounds for immediate suspension of the right to attend meetings, pending review by the Ethics and Disciplinary Committee. Respect the equality, diversity, and privacy of all persons by respecting and valuing differences of culture and opinion. Refrain from unpleasant or disparaging remarks and other actions. Abstain from all forms of harassment by actively discouraging it. Disseminating false information is prohibited. The end. All right. So we're going to move on to our next item on the agenda, which is the review of the meeting minutes. Cindy?
I will have those for the next meeting.
Thank you so much. So we're going to get into the most important part of today's meeting. I'm going to let you introduce it because this is a person that you know very well.
So we have Miss Nubia Earth Martin on with us tonight doing a presentation for us. Nubia Earth Martin is a community birth worker and founder president of Birth from the Earth Incorporated, a nonprofit organization steeped in education and empowerment, providing a variety of health and wellness resources. Nubia holds a master's degree in midwifery from SUNY Downstate Medical Center, a bachelor's degree in sociology from the College of New Rochelle, a postgraduate degree in international midwifery and maternal child health from Mercy in Action, and has completed world-renowned midwife Jenny Joseph's Common Sense Midwifery program. Nubia is dedicated to improving birth outcomes for women of color and toppling maternal mortality and morbidity rate disparities. The legacy and lineage of the Grand Midwives runs deep through Nubia Martin. She sees midwifery not as a profession, but as a way of life and a rite of passage. I'm as a sister midwife, I'm really excited to have Nubia here today. We've run in the same circles for quite a while, so this is really a special moment for us.
Thank you so much for
for having me and for that beautiful introduction.
Now, do you want to start with the video?
No, I think I wanted to start just with a little bit of just context and background on some of the community work that my nonprofit is doing and other community organizations that are serving the Bronx and Yonkers and neighboring areas. And then we can kind of lead into the video after that and leave some time for question and answer, if that's okay.
Sounds good.
Okay, perfect. Thank you. So one, I'm very honored to be here having this conversation. I will put it more as it's going to be a conversation than a presentation. And that's just because that's kind of how the work has shaped up for me. I've been involved in community birth work since 2008. And in 2019, I turned my community efforts into a nonprofit organization, Birth from the Earth, Inc. And in 2021, we were able to open up a brick and mortar location in the heart of downtown Yonkers, which is just a hop, skip, and a jump from the Bronx. And I just want to talk a little bit about some of the programs that we offer for birthing families, some of the classes and trainings that we have, and a little bit about what we do. And I love the fact that your group is focused on diversity and inclusion, because that's really at the heart, I would say, of what we do. A lot of our community work has been in call and response based on what families are stating that they need, and then basically fulfilling those needs by making sure that we are training birth workers so that they can supply birthing families with culturally competent, respectful care. So I'll start by talking a little bit about Birth from the Earth and what we do. So as you stated in the introduction, we are steeped in education and empowerment. And that means that we believe that education is at the key of everything that the community kind of needs. So for example, if someone reaches out, they're newly pregnant and they're not quite sure where to start, we consult with them and give them all the information about the different places that they can birth, the different resources in their area, and help them to make an informed decision about the safest place for them to birth. And then we have a variety of different free community-based classes, workshops, and resources that will help along their journey. So we offer free childbirth education. We have a workshop called The Art of Birthing that couples and families are invited to come to. We have Chocolate Milk Cafe, which is breastfeeding support specifically geared towards those who self-identify as part of the African diaspora. We have Village Baby Showers, and we also have an Access to Home Birth Fund, which helps to offset the out-of-pocket expenses for home birth for somebody who is having a healthy, low-risk pregnancy, has found a midwife or midwife team that they want to work with, and perhaps maybe insurance doesn't cover it completely, or they're just having financial hardship that might make it difficult for them to obtain home birth services otherwise. And we have had that in place since March of 2020. Our original goal with that fund was to help one family per month for the year of 2020. And then a few months after we got that grant, the pandemic happened, and just based on need and people looking into different places, for where they'll birth and where they'll receive services, we've been able to keep that going. So that fund is still up and running. We've helped over 70 families have safe home births with midwives. But really at the crux of what we're doing is just making sure that people can make decisions based on facts, not fear, and that they're informed along their journey. We also train birth workers because we realize as we increase people's interest in maternal health and birthing centers and midwives that work within hospitals and out of hospital birth, that we're going to need to increase the supply of birth workers who can also fulfill those needs. So we train childbirth educators, birth companions, also known as doulas. We train postpartum support birth workers, and we also train birth assistants, which are really important because the majority of the home birth midwives work in private practice here in New York. And we want to make sure that they have a second set of skilled eyes, ears, and hands that can assist them at birth, because evidence-based research says the safest place for somebody to give birth who's having a healthy, low-risk pregnancy is not in the hospital. So we want people to have that option, especially in light of maternal mortality morbidity rate disparities. But we also want to make sure that the midwives are not burned out, right? We want to make sure that we have, providers that are skilled and also have, the support, and they have a good birth team to make sure that we keep home birth as safe as possible. So when I was invited to talk a little bit about disparities, I chose that I wanted to shift the narrative a little bit because I think we've been flooded since probably 2018. I'll say when that New York Times article came out that talked about the disparities in maternal health. And I think we all pretty much know, and if not, I'll just state the stats, that here in the US, Black women die 3 to 4 times more than their white counterparts. And here in New York State, they die 8 to 12 times more. So I feel like we have heard that refrain over and over again. And in my call and response with families in the community, and especially birthing mothers, what I've heard is that statistic makes them very fearful and even consider, or contemplate whether they actually want to have a child if it might be a matter of life and death. And what I'd like to kind of put into perspective tonight for anybody who's listening, whether they are a community member or somebody who is maybe pregnant, thinking about getting pregnant, going to have a baby soon, is that when we're talking about these disparities, there's nothing inherently wrong with people of color, people of the African diaspora that puts us at a higher risk. It is more the way in which Black and Brown is treated that actually influences the outcomes, for births and the immediate postpartum period. So some of the things that we're doing, and this is why I love the fact that your committee is devoted to diversity, equity, and inclusion, is toppling some of those barriers to equitable care. There were many myths going around at first as they were trying to gather information as to why Black mothers die more. And, they ran the whole gamut. First, it was, they don't understand the importance of prenatal care, so many of them don't actually seek out prenatal care in a timely manner. Or, they just don't eat well enough. They have higher incidence of heart conditions and all these different things. That they're, impoverished, and maybe that's the reason why they don't get equitable care. And I think after Serena Williams spoke about her birth experience, that kind of toppled all those myths, right? Serena Williams is not impoverished. She's probably one of the most wealthy women in the world. She's extremely healthy. She's, an athlete. Yet and still, she still had a disparity and almost had a near-death experience in giving birth to her first child. So again, that speaks back to the fact that there's nothing inherently wrong with Black people that puts us at a higher risk. It's more the type of care that they're receiving. And we believe that when we educate people and give them different options and also increase the workforce and make sure that the birth worker community looks like the communities that they're serving, speaks the languages, understands their cultural needs, that's how we're actually going to tackle some of these disparities. Some of the other things that we've been working on here, specifically in Yonkers, is collaborating with our local hospital, which is St. John's Riverside Hospital. It is the only hospital in all of Yonkers where people can give birth. It's actually where I gave birth to my first 2 children. I have 5 children. And after my first 2 births, I went on to have 3 amazing home births with midwives that actually kind of got me involved in this work. But what I didn't realize when I was planning to give birth at this hospital, I won't say how many years ago, but my oldest child is older than 20, right? So 20 plus years ago, I didn't think to look into the statistics for this hospital. I didn't think to look into whether there were midwives who worked at this hospital because I just didn't quite know that was information I should consider. Subsequently, I found out when I started doing this birth work that hospital had a C-section rate of 45.1%. So this was an issue for me because we know that many of the maternal deaths and complications arise from cesareans, or what I sometimes call unnecessarians, right? Where there's a higher risk for postpartum hemorrhage, infection, deep vein thrombosis, pulmonary embolism, which was what Serena Williams was dealing with. And I wanted to kind of understand, how could this hospital have such a high C-section rate? What was happening? So jump to many years later in 2019, as that number was continuing to rise, and I was hearing the stories from birthing families in my community about how they had had 1, 2, 3 C-sections, how they were told that once a C-section, always a C-section. They weren't offered the opportunity for a VBAC, which is a vaginal birth after cesarean. They were denied having labor support at the hospital. I wanted to make sure that the hospital and the staff there understood how these statistics were actually impacting actual families, right? So it's not just numbers, but there are people behind all of these stories. So we had a community conversation in Raleigh in 2019. We invited the community out. We invited birth workers out. We invited people from the hospitals to come out so that we could have a conversation about what could we do about this, huge disservice that was actually happening. And what was interesting was a lot of the hospital staff actually came out and talked about their frustrations, the nursing staff and the maternity ward nurses, about how they felt frustrated at the care that was being given or the lack thereof, and they also wanted to be part of the solution. So that's kind of what got the hospital on board. And myself, my organization, and other community organizations such as Sister to Sister International, Lower Hudson Valley Perinatal Network, the Westchester County Health Department, and public officials like Chuck Schumer and Andrea Stewart Cousins all got involved. We sat down and we talked about a comprehensive plan that included transparency, but also including the voices of birthing families so that they could be at the center of the care that they would like to receive at this hospital. So I'm happy to report present day, we have an ongoing conversation with this hospital. We meet every other month. They have agreed to implement a dashboard on their website so that every quarter families are able to log on and kind of see the statistics for how the hospital is doing. They have changed their policies. They are now welcoming VBACs because I have my ear to the streets. I know that just last week they had a successful VBAC there with a woman in the community who, that kind of changed her whole perspective on birth, right? She felt whole after an experience prior where she wasn't quite sure if her body was going to be able to do this, but now she's been empowered with the knowledge that with an understanding of physiologic birth, a supportive provider who's going to center her needs around her labor and birth plan, that it is possible, and she was able to achieve it. We also are working with existing midwives and student midwives in my nonprofit organization to implement holistic midwifery skills. And I think this is important because as much as, midwifery is a profession, I also very much believe it is a way of life, and there is a spiritual component to it. There's a holistic component to it that has been a little bit, diminished over the years. And I can get into the history, but the video that we're going to watch in a little bit actually covers some of that. And I'd love to have an actual back and forth conversation about that. And I believe that when we kind of infuse both, models into the picture, this is how we're going to be able to reach many different people. For hundreds and thousands of years, people were birthing at home and they were having good outcomes. And as we have kind of moved midwifery more into a medical model, we've seen more disparities, and these disparities are being experienced by people who, self-identify as part of the African diaspora or even just appear, that way. So the care that they get is influenced based on the way that they appear. And we have to make sure that providers are also going through, equity training, and that they recognize systemic racism and biases that might be in place due to the history of obstetrics in this country, right? So when we think back to, the grand midwives of the South and how they were eliminated at one point, and where that left, Black birthing families without a care provider, without the ability to actually enter into a hospital because hospitals were still segregated. And midwives who have been caring for communities for many years suddenly were at risk of being criminalized, right? If they care for their communities, this left many families in a state of, well, where do we go for care? And we have noticed that ever since, the transatlantic slave trade, when the Black woman was a commodity, right, there was a push for them to be able to procreate. And ever since slavery has been quote unquote abolished, we've gotten more into a place of how do we stop them from procreating? So we've had a history of eugenics programs here in this country. We've had a history of forced sterilizations, coerced sterilizations without consent, our high C-section rates. We've had, different forms of birth control that later on we find out can cause infertility issues. And right now we're dealing with a maternal mortality morbidity rate crisis. And, as we kind of talk about all these things and have actual conversations about historically what has gotten us to this point, I think having these continued conversations about what some of the solutions and remedies are is what's going to get us, to the next level of making sure that families are receiving the care that they need. So when we decide that we're going to center families and their needs, and that's going to be what kind of drives the type of care that we give, we're going to see better outcomes. Some of the initiatives that are out right now focus heavily on more doulas, hospital doulas, coverage for doulas through Medicaid. And while doulas and labor support plays a major role in reducing the risk of, somebody having a C-section or improving somebody's, experience or perception of their birth, and it is crucial to have continuous labor support, we do need to talk about the fact that a doula or a birth companion is not a clinical provider, right? So while they can provide support and they can advocate and, be present for the birth, it's really going to be increasing midwifery care and access to midwives that is going to turn this thing around. We know that hospitals have a very important place in our society, and the medical industrial complex and their perspective on care is necessary when somebody is experiencing a high-risk pregnancy or comorbidities. But we also know that 85% of pregnancies are considered to be healthy and low risk. So we want to make sure that we have a variety of birth workers who can meet the needs for each individual family. And for some, that very well might be a midwife in a home birth setting, a midwife in a birthing center setting, or it might be a hospital that has midwives on staff and uses OBGYNs and maternal fetal medicine doctors in a collaborative way. So those are some of the, things that we are kind of putting into place. We have a childbirth education series that goes for 4 weeks coming up in March that is free for community members. So if anybody on here has somebody that they are providing care for who's looking for a comprehensive free virtual childbirth education course, we have that. We have a village baby shower coming up in March that we would love to welcome families in the Bronx, Yonkers, Mount Vernon, New Rochelle, the neighboring areas to come out and be involved in. And one of the things that we're really proud that we do at these village baby showers is make sure that the gifts that we're giving to families are sustainable and eco-friendly. So we set them up with a cloth diaper, kit, right? We could give them disposable diapers and then they'll go through that pack of diapers probably in less than a week. But if we set somebody up with cloth diapers, that's more sustainable and something that they can continue to use. Baby carriers, so that we're reinforcing the idea of skin to skin and bonding with your baby. Gifts that are going to support, lactation, so that people understand that, we have the lowest breastfeeding rates, even lower amongst women of color. And then women of color have the highest infant mortality rates. So we know that when we improve one, we're going to improve the other, right? So we're working to make sure that families have access to IBCLCs, CLCs, community birth workers, community health workers, and that finances is never going to be a barrier to them getting, comprehensive childbirth education, labor support if they need it, access to midwives, and quality postpartum care so that nobody is slipping through the gaps, especially if they give birth with a provider that they won't see again for the next 6 weeks, that there are some, skilled people who are going to be filling those gaps and talking to them about, warning signs for preeclampsia, things to look out for in the postpartum period. My husband runs a Fatherhood Fridays group, which I think is really important to make sure that dads are included, you know, in the picture as well, that they know ways to, you know, support. One of the things that my husband teaches at the Fatherhood Fridays group, he does cooking demos so that in the postpartum period, right, a new mom is not up, you know, day 2 or 3 trying to cook for her family, but during that 9-month journey, their partners can learn how to, you know, help to support them nutritionally as they are supporting and bonding, you know, with their new family. So I know I've said a mouthful, and I want to leave a little bit of space for any questions. And then the video that we're gonna watch is about 60 minutes long, so we can either do questions based on everything I just talked about, you know, now, or we can jump into the video and save questions for afterwards, whatever, you know, the audience or forum would like.
Not 60.
No, I didn't think it was.
16. 16.
I don't know if maybe watching the video might answer some of the questions that I might have personally. I'm sure that Cindy has a lot of answers to some of my questions as well. So I think maybe we should jump into the video, and then if it doesn't cover anything that you know I might be thinking about, we'll ask questions. Yeah. So
Perfect. Sounds
yeah.
great.
So now go to share. And what happened to it?
Is it on Google Chrome? No.
Go to that Google Chrome, that bottom one there. Yeah. Double click on it. Yeah, that should be it.
¿Qué pasó acá?
And then push play.
Can you all see this?
Yes, I can see it. I don't know if you want to make it bigger.
That's the hospital. I'm telling them I'm in labor. I'm ready to push. I have my son. Everything goes beautifully. They take him to the nursery. He's fed. I fall asleep, and about 15 minutes later, a nurse is tapping me, telling me, "Oh, your baby's hungry." And I'm like, I just fed him. And I'm thinking, maybe it's one of those times where you think you've been asleep for 15 minutes, but I look at the clock. It's been about 15, 20 minutes. She goes, she brings the baby. She hands me the baby. I pull back the blanket, and it's not my baby. And I said, I know what he looked like when I handed him to you 15 minutes ago. This is not my baby. She finally checks the identification bands and realizes it's the lady in the next bed's baby. I'm ready to leave. In the morning, I told them I want to be discharged. And they said, well, everybody has to stay for 2 to 3 days. And I'm adamant. No, I'd like to leave. I don't feel comfortable with you all here. And they told me that in order for me to be discharged, I would have to give my son a hepatitis B shot first. They finally bring in the head pediatrician there. It's white male, and he comes in and he says, so what's this nonsense about you're not going to give your son hepatitis B? So I said, it's not nonsense. I said, hepatitis B is transmitted between those who have unprotected sex or those who are using intravenous, drugs. He's a newborn. He's not going to be doing either. I've been tested for hepatitis B. I'm negative. I'm going to be breastfeeding him. I've been immunized for it. So he will get, antibiotics for my breast milk. I'm not doing the shot here, and I want to be discharged. And he says to me, oh, you people always say you're going to breastfeed, and a week later you're not breastfeeding. And I remember feeling like I just been slapped in the face because I'm like, here's the head pediatrician of this hospital saying this. And I said to him, I breastfed my daughter for 2.5 years. Thank you very much. I said, and your hospital brought me the wrong baby to breastfeed last night. You're going to sign our discharge paper, and I'm going to leave. And I told my husband, if we have more children, I can never do it like that again. Just wanted to call and see how you're doing. Yeah. You'd say, how often are they coming now? All right, if you're having one now, I want you to start your breathing. Nice and slow, in through your nose. You're welcoming and bringing forth life. You don't want to be made to feel ashamed. You don't want to be admonished. You don't want to be ridiculed or diminished. You want to feel whole, safe, and at peace. But the way that we're taught, Black women don't feel as much pain, or people don't know or are not in touch with their own bodies, that gives way to violation and abuse. Despite spending more on healthcare than any other country, America continues to have the highest maternal mortality rate compared to other wealthy nations.
The U.S. is one of only 13 countries where the death rate is worse now than it was 25 years ago.
It was supposed to be a routine C-section.
Doors to operating room open, then they close behind you. That's the last time.
This is an SOS situation that we're in. There's not going to be, this, agency that's going to come in and say, oh, well, let's make this right. No, it's still about profit over people. And we have to be the ones to fill the gaps when we see that there's a great need in our community that we have the ability to correct because we've been doing it since the beginning of time. And you notice in the hospital, they don't do the newborn exam in front of the parents, right? Yeah. When I saw either in the baby room or in the nursery, when I saw how they were handling some of these babies, and when I was doing my rotation, I'm like, when we look at New York, Black women die 8 to 12 times more, right? We have worse outcomes here. And the question should be, for anybody, well, why, right? Why in the rest of the country, it's 3 to 4 times, which is already bad enough. Why is it 8 to 12 here? So the fact that you are not allowing certified professional midwives who are trained specifically in out-of-hospital birth to be legal here, that's going to drive up the numbers because evidence-based research says if you are having a healthy, low-risk pregnancy, the safest place for you to give birth is not in a hospital setting. So either in a birth center or in a home birth setting. But if you don't have enough providers that are trained in that way, then obviously the majority of the people are going to birth in a hospital. 98% of births still happen in hospital settings. We don't have birth centers in New York either. So it really is home or hospital. And there are barriers in place to being able to birth at home. So sometimes it might be financial, sometimes it could be logistics wise. There's many different reasons why. The financial reason is a big one because insurance does not cover home birth in the same way that they cover hospital birth, where a hospital birth might cost you anywhere from $30,000 and upwards. A home birth is usually between $8,000 and $11,000, but they don't cover it. It can literally be the difference between life and death. So welcome to the Womb to World Reunion Gathering. This is our 9th year of doing this. We started in 2014. After doing community work for about 8 years and then eventually figuring that I wanted to bring all the families together who have opted to kind of take their birth journeys into their own hands. So I'm grateful that you guys are here because in some way, shape, or form, I've been part of your journey and you've been part of my journey as a midwife as well. And we are trying to amplify what Birth of New York is doing in terms of training the next, set of birth workers, midwives, making sure that families have options about where they birth, how, and with whom, and really bringing birth back to earth. My first 2 births were C-sections, very traumatic, and God put Nubia in my life in time for me to have 2 home births after my C-section.
Honestly, Nubia has just been like a huge blessing. I just had lost words how amazing she is and what she did for me and my family.
Yeah, once you have that home birth and it's like you got your birth partner, right? You got your candles, you got your vibe, you got your music. I remember I was missing music in my first birth and I'm like the auditory home birth.
Oh my goodness. It's life changing. Yeah, because look, I get goosebumps because you have your own music, you have your own smells and you feel so comfortable. My daughter woke up and she's like, oh, my brother's here, and she could meet her brother. And,
Yeah. When you give birth, it's such a amazing thing, and when you're surrounded by loved ones, people who are there for you, for the better you, it's definitely fitting. There's something about being in the comfort of your home where you find peace of mind, your sanctuary, that allows you to birth in a different way. So my births at home were more peaceful, I would say. They were more where I felt I was running, things, and my midwife was just safeguarding. There wasn't necessarily anything that she said or did. It was more holding a space for me
where I didn't have to worry about what was going to happen next. There weren't machines beeping. There weren't people coming in and out of my space or in my room. There weren't people throwing me off of that realm that you're in when you're kind of in between worlds when you're bringing forth life. Nobody disrupts the session. So in order to let us know like how we got to where we are, I have to kind of talk about where we came from. Here in this country, we had the transatlantic slave trade that happened. People were brought over intentionally who had certain skills to help build up this nation and keep other geographic locations thriving. The midwives who were brought over were really essential because during the transatlantic slave trade, the Black woman was a commodity. She had the ability not only to do manual labor, she also had the ability to bring forth children. That child was automatically property. So it was in their best interest to have women having children in rapid succession because it meant that someone could really quickly increase their stock, so to speak. These midwives had to make sure that these pregnancies were healthy, that these women were able to bring forth children that were going to live. And the way they were able to do that was with the knowledge that they brought from their homelands. That was with herbs, that was with understanding the moon cycles, that was with understanding the nutrition, that they needed. When slavery was abolished and there was no longer this need, I guess, for midwives, they began to push birth more into a medical industrial complex simply because they saw that they can make a profit off of it. Now, this country has a history of profit over people, so that meant that they had to discredit the grand midwives. So what happened was you had a lot of white male providers who thought, oh, if they could do it, we could do it. And they were having all of these, deaths, maternal deaths and infant deaths, and they couldn't understand why. I think if they're coming every 4 to 5 minutes, I'm going to go ahead and call Sage and we're going to get ready to head over, okay? And if anything changes between us, talking now and us getting there, just give me a call back. Okay. All right, I'll see you soon. Yes. In present day, we look at birth and birth workers as a profession. I see midwifery more as a way of life. There's a sacredness, but there's also a spirituality to being in tune with that mother and baby. That baby is the passenger. The mother is the vessel. Yes, we have to make sure she's eating right and she's getting all the things that she needs to keep that pregnancy healthy. But if you don't know how to commune with that spirit baby, if you've not made a connection with that spirit baby, you're missing the whole point. It's a spirituality that the profession does not recognize, and it's not something that can be taught. And because they can't package it and market it, they try to diminish it. What's the range that we want? What I realize is there are a lot of barriers to midwifery, not only in this country, but specifically in New York. So in New York, the legal options are to become a certified nurse midwife or a certified midwife. So when I graduated, I finished my program in May of 2018. I received my master's degree in midwifery, and I immediately aligned with 2 private practice home birth midwives who had a practice here in New York for the past 17 years. I asked them, can I birth assist you? And they said, sure. I'm just simply holding space for them. We have a deficit of home birth midwives, but that's solo practice midwives. For me, I feel like that's a model for burnout, and that's a model for early retirement because, you just can't do it all. We need to have more community home birth collectives where there are at least 2 or 3 people working together. That way you always have 2 people at a birth, right? So you have a second set of eyes, ears, and hands. You have one person that can take a little bit of downtime while the other 2 are on call and then kind of rotate. It just makes more sense to safeguard because once that person gives birth, there are now 2 people to care for. What if they both need immediate attention and you're there completely by yourself with nobody else to kind of help safeguard the situation? So the reason why home birth is safer is because there is more one-to-one care. But if we are overrunning the home birth community and we're not increasing the supply of home birth midwives, our numbers aren't going to dwindle. We're not going to see the same level of outcomes. People are going to be exhausted. And there were many who said, well, I'm not going to take somebody because it's going to be a long, labor. They're probably going to end up transferring. Fear is not the reason. And I said, well, I have to argue differently because the history for people of color is we rise to our power in the midst of fear. I think back to our ancestors who may have tried to escape slavery, who might have been big and pregnant, and probably in the midst of escaping, maybe had to stop, give birth, strap that baby to their back and keep on going. So it showed them a different way to be able to come into their power and know their strengths. The difference for people who that is not part of their ancestral lineage is oftentimes they did not have to rise to their power. They had somebody that as soon as that baby was born was nurturing that baby for them, feeding that baby for them. So in their history, what they have to work to healing in this present time, if they want to rise to their power, is breaking that cycle of helplessness, breaking that cycle of somebody coming and rescue me when it's us. We have to rescue ourselves. And for all of the births that I've had the honor of being present at, who may have changed very last minute to home birth, for those who were people of color, it showed them their power. And they were able to now tell other people in their community and their family, look, I birthed at home, and I'm not sure if at home, maybe y'all can go out birthing at home, and it's had this ripple effect.
I would just pause it. You can pause or hit stop.
Hit stop at the top.
So, okay.
Stop.
There. Wow. I have a lot of questions, but I think I'm gonna first ask, if there's anyone online, like a community member who has a question. Let's see, does anybody have a hand up? Somebody just left the meeting. Okay, so I don't see any hands up for questions. And I have a couple, some that were kind of answered in the video. So what I got from this was, if you're not at high risk in your pregnancy, then you do better giving birth at home than you do in a hospital, right? That was kind of shocking because I was like, why, right? Why is that, the case? And then, some of the video, I noticed that there were some, conversations about, being less stressed out, right? The things that happen at home that make us more comfortable, right? The familiarity, and all of that. And are there other reasons besides that?
Yeah, I think the number one reason is probably you're getting one-to-one care, right? Whereas, in a hospital, depending on how busy they are, there might be, staff that's caring for a couple of different people who might be laboring at one time, right? And just by design, even during prenatal care, if you're getting care like in a clinic or a hospital setting, depending on how many people are on a roster, for the day, you might sit in a waiting area for, a good 30, 45 minutes, but you might only have maybe 15, 20 minutes with your provider. Whereas, with midwives in all settings, I'll say, midwives are able to give individualized care where a visit might be 45 minutes, it might be an hour based on the questions that this family has, based on their history. When we think about the fact that Black women are at higher risk for a lot of things, that is because of, ancestral trauma many times. We talk a lot about heart issues for Black women, but I ask the question all the time, does it make sense that Black women in their 20s and 30s are having cardiomyopathies and congestive heart failure? Well, no, they haven't done enough living in life to really do that type of damage to their hearts with lifestyle and, food choices. But if we think about ancestral trauma that is part of our cellular DNA and our heart chakras that have been wounded due to atrocities that we went through during the transatlantic slave trade that have not been acknowledged, reckoned with, reconciled, and healed, then yes, that does get passed on generation to generation. So those populations do need more culturally congruent one-to-one care, and they do better actually in those settings where they get to have somebody who can not only individualize their needs, but also include certain parts of cultural healing and spiritual awareness in their prenatal care and labor and birth experience.
Yeah, because that shocked me, right? I honestly had thought that there was some health reason for why Black women had a higher rate of, even like infant mortality rates, all of that, right? And clearly there's no health reason, no physical reason
Right.
outside of the trauma that you just mentioned. So that was shocking to me.
Yeah. I just want to add also to your point, even last year, I believe in February, the New York Times put out an article that talked about the difference between outcomes for those who are experiencing poverty and those that are quote unquote, rich. Even when they had the same health risks, even when their pregnancy fell into the same type of risk category, those who were considered to be impoverished had worse outcomes, not only for the mothers, but also for the infants born to those mothers than those who were, rich. So, and when we think about just, what populations those often are, they are, typically families of color. And that's for a number of reasons that, we won't get into on this call, but we understand, socioeconomic factors and the history of that. And then also when we think about things like preterm birth or low birth weight babies, hypertension in pregnancy, think about the stress levels that people of the African diaspora deal with just showing up every day as a Black person or a person of color in America. Add on top of that the stress of, a pregnancy. Perhaps that mother is the head of household. Maybe her job is a little unstable. If she does not have adequate childcare, then that, puts her job at jeopardy. So you have all of these stressors. You have an influx of cortisol and adrenaline. What we really need is, oxytocin and to be able to de-stress. So things like prenatal yoga and making that accessible to families, meditation, healing through dance, right? Havening and somatic release techniques. These are things that need to be incorporated for those populations that are already going to deal with a higher stress level that's going to impact outcomes for mother and baby.
I have a question.
Hold on one second. Give me a second.
The Bronx?
Hold on one second, please.
Mhm.
We're gonna do this one at a time. Naomi, who's one of our members, or has a question. Has her hand up. Go ahead, Naomi. Just go.
Hi, how are you? I really enjoyed your presentation tonight, and
Thank you.
I saw that you dealt with for Cure for Moms,
Mhm.
and I suggest everyone follow him if you can. He is doing miraculous work in legislation just for moms, Black moms, and maternal care. So I would definitely suggest that you follow him. But I
Thank you
did
for
want
having
to
me.
add to one of your points about medicine and Black mothers.
Mhm.
And in childbirth. And I think sometimes we forget that, it's like Jim Crow laws were, visibly terminated, I want to say, in 1968. So just think about, and so that's when Black mothers have started to percolate into all hospitals, right? And so we forget that, that was only like 30 years, 40, 50 years ago. That's not a lot of time or for medicine to catch up with how to take care of Black mothers. And there is a difference. And think about it, we're coming from a point of mostly having midwives, right? Because we couldn't afford to go to the hospital. So we had mostly midwives and we had a better success rate. And now we're matriculating into a community that doesn't understand us and didn't prepare for us or educate their doctors to take care of us. So I just wanted to just make that point.
Thank you for that. And you're absolutely right. And yes, Charles Johnson is, the person to follow. He is doing amazing things with legislature. And then also, I happen to have the sweater on tonight, Save a Rose Foundation, which is Bruce McIntyre, who he lost his partner in April of 2020 at a hospital in the Bronx here to, maternal death shortly after giving birth to her son via C-section. So, these are people who are taking their pain and turning it into power by way of speaking to legislators, assembly people, Congress people, to make sure that we are acknowledging the root causes of maternal deaths and actually implementing, changes that are going to have an impact on improving maternal outcomes. So thank you for that comment.
Thank you for this. I love midwife centers. I think they're so great for babies. But you said that there was none in the Bronx, and I was under an understanding that Jacoby had some. I understand that hospitals did have a birthing midwife center. Is that not true?
So when we're talking about a birth center, if we're talking about a birth center that is part of a hospital, that's not a freestanding birth center. So they're still connected to a medical industrial complex. We do have one birth center in New York, which is in Brooklyn, the Brooklyn Birthing Center. But that's the only freestanding birth center that we currently have. We are fighting to have midwifery-led birth centers. We did get that legislation passed back in 2018. However, there is a lot of red tape currently to actually get those birth centers opened. And there are midwives who are ready, willing, and able and would like to open up birth centers, midwifery-led birth centers that are independent of hospitals, but have relationships with hospitals so that people can actually get the midwifery model of care. However, there is a really long, arduous process that has to be gone through to get your application approved, and that is through the health department. And in the meantime of getting the application approved, which can sometimes take more than 2 years, you have to hold a lease on a commercial space that you can't run as a birth center, so there's not going to be any income there. And many people do not have the funds to be able to keep that going in the hopes that their application gets approved. However, birth centers can be opened by MDs. So the Brooklyn Birthing Center is run by a doctor, and then it is staffed with midwives. So that's why they were able to open. Even here in Yonkers, back in the 90s, there was a birth center, a freestanding birth center that existed. It was a husband-wife duo. The wife was the midwife, the husband was the MD. And when they divorced, he closed the birth center because the midwife didn't have any recourse to run the birth center on her own because of legislature. So as the previous person, just spoke about the importance of advocating and getting politicians and people who can actually implement, policy change involved. This is one of the things that we're working towards.
But what happened, because there used to be, I had my baby in 1981 in a maternity center, which was on 96th Street, a big, beautiful birthing center. And then my my granddaughter in 2000, Jacoby, they had a midwife birthing center too. Are they not there anymore? Is this since the COVID or what?
It's since before COVID, so many of these places, have closed down. So there are still midwives at Jacoby. There's just not a birth center at Jacoby. Just like Morris Heights, they used to have a birth center. There's no longer a birth center there. What's another North Central Bronx Hospital used to have a birth center. There's no longer a birth center. So what happened was the hospitals are still integrating midwives and midwifery care, but there's not a birth center. So the care still mimics and very much looks like, the medical industrial complex model of care. And if you've noticed, if you follow the trends for when those birth centers closed and look at how maternal mortality and deaths and morbidity, close misses have risen as those birth centers closed, we know what the solution is, right? Or one of the solutions to reduce maternal mortality disparities, right? So these are the things we have to get back to, the things that were working, and we've gotten really far away from that. And as I spoke about earlier in the conversation, yes, having continuous labor support in hospitals is part of the solution, but it is not the solution. We need more providers that can actually apply the midwifery model of care.
And I wanted to say one more thing. Why it's a low risk is because this is something that I'm glad it's exposing it, that your reproductive system is actually your heart, and that's your DNA and your RNA. So this is like, your heart is more like a carburetor. It's the cardiovascular. And there wasn't, I'm very old. I'm very old. And there was not a lot of Black people in America, believe it or not. In the 50s, when we had artificial intelligence, that's when people started to come here. And I know this, and sadly, when AI came right away in the Bronx, right here, they said there was the electric chair. America, the president put his hand on the Bible. We were never supposed to have capital punishment ever, but there are enemies that wanted to take the artificial intelligence, and that's when they started to take over, and my family was part of that. They started to take people like Arthur Paley. They just made a Paley museum, and I heard that he was kidnapped, and he had to do with Huntington, Arthur Huntington.
Do you have a question?
My question is, so with the low risk, and I would like you to help, because you see the most important thing is babies and birth, and midwives are the best because the woman gets the education, which makes her feel safer, where people don't panic too. But this in other words, your hair is dead, and when you cut it, it doesn't hurt. They made a lie between black and white. You couldn't use shampoo. And
Okay, I'm gonna ask you,
that's your DNA. It tells you if you're a man and a woman. So that would people really want an
I need
abortion
to ask a
pill?
question, or we're gonna have to move on.
Okay, my question is, with all living creatures, okay? I believe, and I want to know if you agree with me, that there is some type of enemy that wants to turn people away from God and to abort babies, whether it's an animal. They're messing with horses with this abortion pill. That hurts your business because you want to have babies. So do you agree with me
You don't have to answer that question, Nubia. I'm sorry, this is not the forum for that question.
Oh, okay.
We're gonna move on.
That's why low risk.
Can I say something? Naomi, do you hear anything? Did they mute it? Huh?
No, no, they hear you. I can hear you.
Because okay.
Yeah, I was gonna say, go ahead, girl.
I think we can't hear the people in the room.
Something, because I think they muted us.
Oh, yeah, they muted. No, they didn't mute us. They muted themselves.
Oh, they muted themselves. Okay. Well, I'm gonna say thank you, my sister.
They said hold on a sec. They said hold on a second.
Oh, okay.
So Nubia,
Okay.
one thing I wanted to just kind of mention is that one of the challenges for me as a midwife in a hospital is working with a completely different philosophy, right? So I've got my philosophy, which is similar to yours, but I'm working in a system that doesn't really let me exercise that to its full extent. And I know that one of the things that I've always, thought might be, maybe on my wish list is bringing more of the midwifery model to obstetric training of residents.
Yeah.
Two of the attendings that I've worked with closely over my career have been people who were trained by midwives.
Right.
And it made such a huge difference in how I practice and just on how our hospital practiced.
Yes.
And it's something that's gotten lost over the years.
Yeah. Yeah, I think, that the true collaborative model of care is, all of us kind of working together. We're grateful that, there are midwives who are working in hospital settings because we know the majority of people are birthing there. So we want them to be able to have, whole, experiences wherever they choose to birth, right? And that's what, midwives who are working in hospitals are able to do. Yes, there's going to be challenges, right? There might be some pushback depending on the institution and the other staff. But I think the exposure to seeing physiologic birth for many of these, residents and, doctors is going to be important. Sometimes they haven't actually seen it. So it might seem like an impossibility. But even thinking about the hospital out here in Yonkers, they asked if I would come in and kind of teach their staff about what physiologic birth looks like. That's a step in the right direction, right? Some people are going to want that. Some people might actually warrant a higher level of care or some, interventions that are medically necessary. But for those who, would like to have a physiologic birth and not have any unnecessary interventions, the entire staff needs to kind of know how to adapt based on what the birthing families need. So we're grateful for midwives, in hospital setting, especially, when home birth midwives need to transfer. We're grateful to have places that, have compassionate staff, available to receive. And also just to, collaborate and realize that we all have the same goal in mind. We want to see improved outcomes and the best maternal health care for the families in the communities.
Wendy?
Hi, thank you. First of all, thank you, my sister, for coming and just bringing this topic for discussion. As a person myself who's had several miscarriages and 2 stillbirths, this is definitely something that I needed to hear, especially with my last pregnancy, where I had to be the advocate. And I was very adamant about what I wanted, doctors that I wanted, because I was prepared to sue everybody, right? Because it is a trauma experience every time you have to walk into a hospital for something, right? So to go in one way and come out another, or come out with someone with not having what you went in with. Yeah, it was trauma. So I thank you for bringing this topic up. And we definitely need to discuss it more because healthcare for Black women, women of color, is something that needs to be talked about. I was someone who was scared when the documentary came out. You mentioned the couple the wife who died. I actually had the baby in that hospital, right? So it was just like, it was knowing the story and then Hulu coming out with the documentary and then going in for a C-section, it was nerve-wracking. And thank God for the ancestors, because I don't know how I would have made it.
Yes. Thank you so much for sharing that. And, just want to take a minute to acknowledge, those babies that transitioned. And just the more we have these conversations, this is how we begin to heal, right? Through the art of storytelling, through the art of tapping into our ancestors and recognizing, when trauma is at hand, and then creating spaces within our communities that is going to help to, bridge a gap to how we effectively heal.
Okay. So Nubia, I wanted to know a little more about this Fatherhood Fridays.
Yes. Yeah. So it's every 4th Friday of the month from 6 p.m. to 8 p.m. It's via Zoom during like the winter months, but then when the weather gets warm at our space in downtown Yonkers, Earth Grounds, they meet in person. And I can't tell you exactly what they talk about because it's a space reserved for, the dads. But sometimes it's new dads, sometimes it's expecting, soon to be dads, sometimes it's OG dads, but really talking about how they show up as part of the family dynamic. Sometimes the dads just have questions for some of the, attendees who are already, fathers about how can they best support, their partner during the pregnancy, during the labor, how they can best be, beneficial in the home immediately postpartum. What questions should they be asking at visits? So it's just a space that kind of celebrates their presence and the importance of that within the family unit, because I think sometimes, and especially during the pandemic, when there was a lot of separation of, partners being able to attend prenatal visits or being present in the birth room for a period of time, it's a way of reintegrating, that and making sure that they don't get lost in the shuffle. There are two, co-creators, so to speak, when we're talking about, birthing family, and we want both of them to be an integral part of maternal health. So one of the things that we're really pushing towards is that maternal health is not just on the shoulders of the birthing woman or the mother or the birthing person, but it's also her entire village, her partner, her grandmother, her girlfriends, her sisters, who can also have a hand in helping to advocate for her and make sure that her pregnancy stays, healthy and, that she survives and thrives through it.
Thank you very much, Nubia. Are there any other questions that we have online?
Diana's quiet.
She's recording tonight. There she is.
I'll ask two questions. One is, do you think that a large part of the problem is that doctors and medical staff tend to think that Black women don't feel as much pain? And also, I was really interested in what you said about telling the story, because I think that's such an important part of dealing with it, telling the story of how you gave birth or what happened.
Yeah, definitely. Well, to your first part of your question, remember we had J. Marion Sims, who is, the godfather or the father of modern gynecology here in America. And that was one of his tenets, right? That Black people or Black women do not feel pain in the same way that, their white counterparts did. And he was known for practicing obstetric surgeries on enslaved Black women without anesthesia, sometimes 30 and 40 times to perfect his craft, right? So there's actually a conference that's happening next week that I'll be attending in Alabama, which is the Betsy, Lucy, and Anarcha conference. Betsy, Lucy, and Anarcha were three of the enslaved Black women that J. Marion Sims practiced on. So there is a whole monument built to them. And they have taken over the building where J. Marion Sims did these surgeries to pay homage to these women and to talk about how that, that myth or that, that idea continues to pervade the way in which obstetric providers have been trained, right? So whether you consciously believe it or not, when that is part of your education, it's going to be part of an implicit bias that you are inflicting on people when that was part of your, education and training. So we are going to be unpacking like what that looks like and how do we change that trajectory. So I do believe that plays, a big part in the type of care that's given with that misconception. And then I'm blanking on what your second question was. I'm sorry.
It was about telling stories,
Oh,
how
yes.
important it is to then
Yeah.
whatever kind of birth experience you had to
Yes.
tell the story of it.
Yeah, well, the ancient art of storytelling is definitely, part of many people's cultures, including those of the African diaspora. I sit on the board for the Black Coalition for Safe Motherhood, and I co-wrote a curriculum called the ACT curriculum, which is an acronym. The A stands for Ask Questions Until You Understand the Answers. The C stands for Claim Your Space, both physical and mental. The first T stands for Trust Your Body, and the last T, which I think is probably the most important one, is to tell your story. So, we've heard many tragic stories, but there are also many beautiful stories. And that was part of, the documentary, wanting these birthing families to be able to talk about or depict some of their birth experiences that were positive, right? To not only talk about the negative things that are happening, but thinking about ways that we kind of surpass the negative, aspects of it, or that we educate, a provider in talking about, your birth plan and making sure that you are taking up good space, in that office with your provider, right? They're making eye contact with you. Are they asking you the same questions at every single visit? Does that mean, are they paying attention? They making sure that you are an integral part of your own birthing journey, right? That is the true art of what midwife means. It means with women, right? Being with somebody along their journey, not dictating to them what's best, but making sure that they are an active part of their own care.
Christine, can I just add something to that? Because you mentioned the statue, right? So let me just tell you how powerful a community board can be. I actually sat on Community Board 11 East Harlem, and we spearheaded that along with activists and political officials to get that statue removed. And Mount Sinai had wanted to put that statue, because it was what the GYN side of Mount Sinai was kind of built on. But we 100% removed and paid homage to all of the victims of that gentleman. And so now that statue lies at his cemetery, right? Where he's placed, laid to rest. But that's the power of the community board, right? So if there's something out here in the community board that we feel oppresses us, we have the power and to use the power of the voice to do something about it. So there is no excuse.
Yes. Thank you so much for that community work on that, because that was really powerful. And I feel like that was felt and it made people feel seen, and acknowledged and heard that these past atrocities, continue to have a ripple effect present day if we don't correct those wrongs. So that was a huge win, for birthing families. So thank you for all your efforts on that.
Nubia, I have some questions for you.
Sure.
I'm sorry.
Okay.
A lot of those questions were actually answered, because I think a lot of other people had the same questions. And I hear this about, the medical world, right? Doctors, OB-GYNs, whoever they are, not being sympathetic to Black birthing mothers, right? What do you recommend moving forward for a young mother with who is planning her birth, a child's birth? What kinds of questions should she be asking of her medical provider? That would make her feel more comfortable about whether she should choose that provider or not.
Yeah, I think first and foremost, she has to ask herself what type of birth experience she'd like to have, what's important to her, and then once she's kind of determined that, you want to interview your prospective providers the same way you would for anything else, right? You want to find out if they have a philosophy that's going to, respect your own philosophy on birth. You also want to practically understand like what your risk level is in your pregnancy. And this is where preconception health is really going to come in handy, right? If people are starting to think about their health status prior to getting pregnant so that they can, have a low risk pregnancy and have all of the options of where to birth, hospital, home birth, or birthing center, at their, their free will to choose from. But when asking, providers, one of the best questions I think that they should ask is, am I going to be able to be an integral part of my own care? If I have questions, are you going to have time to answer them? When it comes down to it, can my partner or other family members who are important to me and who help me make decisions, can they be part of that care? What type of routine, interventions do you typically use, or do you make your decisions truly based on medical need and risk? That's a big thing, to ask somebody, because some providers do have their own protocols for how they do things for everybody. But we know that, birth is not a one size fits all, type of model. So I think those are some of the preliminary questions, but then also trusting your own instincts. Do you feel comfortable with this person? Is this somebody that you can have a conversation with? Do you feel that they are vested in your care? Do you trust them? That's going to be a big part of how your labor unfolds. If you're made to feel fearful, adrenaline cannot coexist with oxytocin. And that is what we need in labor for that labor process to unfold naturally. When we are made to feel fearful in whatever setting we're in and adrenaline is on board, that's when, things like Pitocin and artificial oxytocin need to be used or are often used to try to get natural labor flowing again. But if you are made to feel safe, at peace, informed, and comfortable with your provider, I think those are the biggest steps in the right direction. And if you don't feel that those things are happening, you always have the right to seek out another provider. You don't have to stay with somebody that you don't feel is vested in your care or that you feel, comfortable with or that you can have an exchange and conversation with.
Thank you so much.
Thank you.
Any other comments or questions before we wrap it up?
Yeah, I do. One, I just want to say that maternal care is the most important. It's the most important job a woman does, bringing life into the world. We do not take the time to invest in the education of maternal care. So I feel the community board should, definitely make this one of its priorities in the community, and either in the health committee or DEI, wherever, but it should be one of the top priorities because it's something that our board is made up mostly of women, and this is something we really should maybe take a charge in making sure we educate our community, educate all women in terms of maternity care, because what Nubia said is so important, that in researching your providers. I remember I went to the hospital, the provider that I had wasn't the provider that did my birth. And it was a totally different, it was not a good experience.
Yeah.
Because the person I'm used to talking to about how I'm feeling, how I'm doing, and was not in the room at all.
Yeah. The person that you had continuity of care with, right? The person that you built up a relationship with is then not there at one of the most sacred, times. So that's another thing that often differs in the midwifery model of care and the medical industrial complex model of care, that there is continuity, there is, time to build up that trust with somebody. And when that rug is kind of pulled out from under you and now you're seeing a brand new face, that's a big adjustment. Your body is going to respond to that, right? Because our body wants to
know
protect
you.
us. Yeah.
Right. He doesn't know, a person that doesn't know you doesn't know your history or anything. And so, it's important, like Wendy was saying, to be your advocate. And we should be trying to help our community understand that it's not just a one side. It's not just you going to the doctor and having a baby. It's actually both sides have to be invested in bringing this life into the world. The other thing is, I just wanted to mention, there are a lot of doula programs, which is Medicaid is starting to pay for. So I just wanted to mention that because some people are looking for jobs and things of that nature, and that may be something that you may want to do. Midwifery or doula, they're doing certificates and they're starting to pay for that. So I just wanted to mention that.
Thank you.
Also, in the maternity center do you use drugs and stuff? Because the other ones, they did not.
I'm gonna have to start raising.
I'm not sure if that was a question, but typically, like in a birth center, drugs are not used. But if drugs are needed, then they might transfer them to a hospital. It depends on the person's, desires. Some people want to birth in a birthing center, but still might want pain medication. But if there's a higher level of care needed, then when a birth center is connected or part of a hospital, they would then get transferred to the part of the hospital that has a higher level of care, which might include medical, intervention and, certain drugs to keep mother and baby safe.
What you mentioned before, the oxytocin for the adrenaline or something that you were
Well,
mentioning?
oxytocin is just a natural hormone that our body produces when we laugh, when we breastfeed, when we give birth, when we hug somebody, when we make love, right? And when we're in labor. So that's something that is naturally derived in our body. But when adrenaline and that fight or flight hormone is present, when we're made to feel fearful, oxytocin immediately leaves the room, right? So I was just speaking to the idea of your birth environment, wherever you're birthing, hospital, birth center, or home, needs to be calm where the mother and family feel safe in order for that natural oxytocin to be present for the birth process to unfold without, incident.
Because that's what I was understanding, low risk. If a mother needs even like an epidural or something like that, then it would go to the hospital. Is that the same what you would do, or no, you do that?
Yeah, if an epidural is needed, that can only be administered in a hospital.
All right, so that's what I was saying. The holistic is the maternity center.
Yeah. Thank you, Nubia.
Yes, thank you so much for having me. This was a great conversation, and thank you for all of the work that you're doing in the community. And I'm happy to collaborate in the future in any way.
Yes, yes. Talk to you soon.
Thank you again.
Thank you so
And we
much.
definitely will be reaching out to you again on your wonderful expertise here in this realm. Let's see, let's move on. I think we covered everything that we needed in
Nubia, if you want to go, you can go.
Okay, thank you so much for having me. Have a beautiful night, everybody.
Have a blessed night.
Thank you, bye.
We're gonna move on. Gallery session. We kind of went through that, in our discussion. I don't know that anybody has anything to say on the topic, so we're just gonna move on.
Diana?
Oh, Diana.
Yeah, this is for gallery session, separate topic. Is that okay?
Yeah, absolutely. Go ahead, Diana.
Okay.
You got
So-
2 minutes.
Okay, I mentioned this at the leadership. When I was putting up the flyers for our PECA meeting, I went to 2440 Boston Road, which is the senior NYCHA, because we have members there. And I saw that the front door lock was completely broken. There are 253 apartments in that building, 261 residents. So it means most of them live alone, elderly people living alone. And I texted the NCO officer for the projects, for NYCHA, and he texted me back to say, yes, in 2440 Boston Road and Pelham Parkway houses, there are currently 16 doors with broken locks. And he said that every few days he gets a report on how many broken locks there are. And there's nothing beyond that he can do about it. And he said NYCHA knows, but it's just this persistent situation. So
Diana, I just want to clarify. Did you say that how many locks are broken?
16 doors.
16 doors to the NYCHA
doors.
entrance. Okay, entrances. Okay.
In Pelham Parkway houses and Boston Road are currently broken. And that the situation is so bad and persistent that every few days he gets a report on how many broken doors there are. But they never get fixed. And that corruption situation with the supers taking the payoffs for repair jobs, there were people fired from Pelham Parkway houses for that, as part of that. So I told him I would bring it to everyone's attention. So I'm bringing it to everyone's attention because I think that's unacceptable. I mean, these doors are wide open. It's crazy, and especially in the senior housing.
Yeah. Thank you, Diana. All right. Is there anybody else in the gallery? No? Okay, we're gonna move on to, we don't have person quorum, so there are no motions that can be made.
Christine, I'm sorry, I have a question. So
Sure.
what Diane just said, are we passing that on to housing and charging them to bring NYCHA to the table?
To Hazel at the housing committee?
We definitely can, speak to Jeremy later on. Maybe somebody at the office can make a phone call to NYCHA and put in the concern. And also pass it to, the housing committee. You know,
Yeah, it
Hazel.
should be a recommendation from
Yeah.
us.
And
Yeah.
public safety as well.
Public safety, yeah, I was gonna say that.
Yeah, it
Yeah,
should be a
so there's
recommendation from us.
There's a few, yeah, the committees that I'm sure that could, you know, community development, we can all put pressure on them to, make sure that they look into that. For sure. Was there something else, Diana, that you wanted us to do with this information?
Just bring it to the attention of as many people in power to do something about it as possible. Because, you know, one broken lock I can see for a couple days, but 16, and it's just a persistent situation so that every 3 days or so, the NCO gets a report, but he can't do anything about it. I mean, it's, you know, a waste of his time
say
and
they-
resources too, to be going around chasing broken
Was there a
doors.
reason why they couldn't, they said they couldn't do anything about it? What was the
No, the
rationale?
police officer said he can't do anything. There's nothing he can do about it. And he said NYCHA is aware, they know that the doors are broken.
Okay, but they have brought it to NYCHA's attention.
Yeah, I mean, NYCHA knows, they just don't repair the doors.
Gotcha.
And people do come in and sleep in the stairways and hang out in this, you know, people who don't live in the buildings do come in and sleep in the stairways, hang out in the stairways.
We have a full board meeting on Thursday. Maybe we can bring it up there in a new business as well, Diana.
Mhm.
Thank you. Any old business? No. New business?
Well, I was hoping we would have a quorum
Quorum.
to discuss March being Women's History Month and what we might be able to come up with as far as some sort of an acknowledgement, but if you guys have any thoughts, ideas, suggestions, feel free to email me or Christine and maybe we can, you know, come up with something.
I have a for women's history, because I don't know if you know, but in Albany, they used to have a refinery. I used to work there, and that's what's, you know, there's a lot of stuff going on to, a lot of lies to make money. That's why I wanted to talk. So I wanted women's reproductive rights. They're making a lot of women poor and wanting them to sell their eggs. That's what I was talking about, the reproductive system. What do they want people to take all kinds of pills if it's going to stop your hair and your nails growing and the growth of your cells? That's what this abortion pill does. So I wanted to talk to that. And they took horses from Colorado, wild horses, and they have them, there's prisoners taking care of the horses, and like 100 of them died before, and then they're doing it again because they're doing study on the horses about abortion, to abortion pills and stuff like that. So that was one thing that I wanted to make a march on the UN, that they are not keeping peace among the nations. They're spending money to combat Mother Nature, and there's more to this global warming because we are losing the law with, now this is where the inclusion comes in, because I was down in the state building and they're contracting out security. And when you go, if you want to see the DA, you don't need an appointment, but the security that doesn't work for the government. So somebody's stealing the salary that should go for them to make a family of security where they get perks, city workers, state workers, they get different, job provisions and protection.
You have 30
security.
seconds.
Okay, so they're putting people with disabilities, they got a contract with the social services, the back to work, and then they put those people in and are pocketing the money, some corruption like you heard about the NYCHA. And lastly, is they're putting people with cognitive disabilities in different jobs and even putting temps in government jobs. And that's why we're having a lot of failing and robbery being robbed. Because they made it a law, you can't steal a phone number, and they stole my phone number.
Okay, thank you so much.
I have new business.
New business.
Yes.
Hi, Miguel.
Hello, everyone. My contribution to new business is how cute is Wendy's baby?
Very cute.
I saw her.
Thank you, darling.
There.
Thank you, Miguel.
All right.
If there's nothing else, make a motion to adjourn this meeting.
Motion.
Second, yep.
All right, it is 8:36 p.m. 8:36.
Have a wonderful night.
Thank you all for your time.
And happy
Thank you,
Black
everyone.
History Month. I'll see you guys on
Thank you,
Thursday.
Sweetie.
Naomi, call me.
Okay.
Thank you. Have a good night.
Hold on. Because you have to save files.
What?
Oh, well, there's nothing in the chat, but you have to save files and stuff.
Where is it?
You have to check the box. Where's Jeremy?
Jeremy, have a good night, Jeremy.
Well, I just texted him. He's not on.